Hi, I'm Rachel Wall, founder of Inspired Hygiene, and we get a lot of questions from our clients and the folks that we speak to about when to refer to a periodontist. So if you're in a general practice, this is a question that comes up a lot, right, as you're learning about being more proactive with periodontal disease and your existing and new patients. And so I had the pleasure just this week of having a really neat conversation with a periodontist from Oklahoma, Dr. Reeves, and he gave me permission to share his idea of when a general dentist should consider referring their patient to a periodontist. Okay, so three clues that he gave us, or three times that we should consider referring. Number one is a very advanced case. So let's say you have a new patient that comes in and they have generalized 7 millimeter pockets or deeper, mobility, lots of bleeding, pus, those very advanced cases that sometimes you may even wonder, or is it even worth treating, or is this a patient that needs full mouth, dentures or implants? Okay. Number two is what he calls the event referral. So this is a patient that is in need of grafting. This is a patient that perhaps needs an implant placed, and you don't do that in your practice. Or, for example, they need some crown lengthening for you to get a better margin, right, when you're doing a crown. These are what he calls event referrals. And I would encourage you to reach out to your periodontist and have them come and do a lunch and learn for you so that they can share with you a little bit more about what they offer, particularly with these event services, because you may not even be aware of what it is that they provide. Also, ask them specifically if they use lasers in their treatment, and if so, what type of lasers. Because there are certain lasers that are used to do procedures like LANAP, laser-assisted new attachment procedure. Some periodontists are doing this, and those patients are best treated with the laser first rather than non-surgical therapy. And then the third time that he suggests that general dentists consider referring is when you've done non-surgical therapy, scaling root planing, and you're seeing that patient back. You've seen them 2 or 3 times after their therapy, and either they're starting to relapse and you're seeing more bleeding, deepening pockets, or they just didn't respond. And certainly we teach our clients several tools to have in their tool belt to treat periodontal disease and adjuncts to have in addition to scaling root planing. So we want to make sure that we've looked at all of those. But the thing that we hear a lot from periodontists is that sometimes general dentists wait too late to refer. And too late in that maybe it's, there's irreparable damage, and now it's maintaining areas of deep bone loss. So the 3 times that this periodontist suggested referring is very advanced cases, the event referrals for specific procedures, and then when you've done non-surgical therapy and the patient isn't responding as you'd hoped or has a relapse. Now, I think this is very reasonable. I think it gives the general dentist the opportunity to evaluate and treat some of these things in their practice, and also to build a great relationship with their periodontist. And you're going to hear more from me about this in the future. We've started to do some work with periodontal practices, and I think they would like to have better lines of communication with you, the general dentist, and vice versa. So until next time, thank you and stay inspired.